The FEP Medicare Prescription Drug Program, or MPDP, is a prescription drug benefit exclusively for Blue Cross and Blue Shield Federal Employee Program members with Medicare. We're always looking for ways to help reduce your out-of-pocket costs. With MPDP, you get the same FEP health plan benefits you're used to now, plus more prescription benefits that can help you save. This includes more approved prescription drugs in some tiers than your current benefit, lower out-of-pocket costs for higher-cost drugs, and a cap on the amount you pay out-of-pocket on prescriptions annually. Even better, you don't pay a separate premium for MPDP. It's part of your Blue Cross and Blue Shield service benefit plan coverage. You're eligible for MPDP if you are an FEP member, enrolled in Medicare Part A and/or Part B primary, and live in the U.S. or a U.S. territory. MPDP has 4 drug tiers. Tier 1, generics. Tier 2, preferred brand name. Tier 3, non-preferred brand name. Tier 4, specialty drugs. The amount you pay for a drug depends on the tier. In general, the lower the drug tier, the less you pay. Please note that with MPDP, specialty drugs are considered Tier 4 drugs. A unique benefit of MPDP is that you have an annual pharmacy out-of-pocket maximum. An out-of-pocket maximum is a cap, or maximum, on the amount you'll pay in copays and allowance. In the case of MPDP, it's a cap on the amount you'll pay on prescription drugs for the year. That means if you're in standard option, you pay no more than $2,000 annually on prescriptions per member in MPDP. And for basic option and FEP Blue Focus, you'd pay no more than $3,250 per member. Once you reach the maximum for the year, you pay nothing for your prescriptions for the rest of the year. You still have an overall medical out-of-pocket maximum. Your MPDP pharmacy out-of-pocket maximum is part of it, not added to it. With MPDP, there are 2 ways to fill your prescription drugs: at an in-network retail pharmacy or through the MPDP mail service pharmacy. You have access to a larger pharmacy network than the traditional FEP pharmacy benefit, over 65,000 preferred or in-network retail pharmacies across the U.S. And with the MPDP mail service pharmacy, you can fill up to a 90-day supply of your medications and have them delivered right to your home. Want to see how much a specific drug will cost at local pharmacies or with the MPDP mail service pharmacy? Check out the FEP prescription drug cost tool at fepblue.org/MedicareRx. You can also compare the cost of medications to the traditional FEP prescription drug benefits. You might be wondering about enrollment in MPDP. We will automatically enroll members who meet the following criteria. You have Medicare Part A and Part B primary. You do not have Medicare because of end-stage renal disease. You live in the U.S. or a U.S. territory. If you want MPDP, you don't need to do anything. You'll receive a letter letting you know that you're in the automatic enrollment. If we need any additional information, we'll send you a separate letter. If you don't want MPDP, you can opt out and keep your current FEP prescription drug benefits. The automatic enrollment letter will provide instructions on how to opt out. If you miss the opt-out deadline in the letter, you can tell us at any point that you want the traditional FEP prescription drug benefits instead of MPDP. If you decide you don't want MPDP and later change your mind, you can get it during open season in a future year. Additionally, if you are not automatically enrolled and have Medicare Part A and/or Part B primary and live in the U.S., you can also enroll in MPDP. Simply download and complete the voluntary enrollment form for the plan you're enrolled in at fepblue.org/MedicareRx. We're here to help our members save money on the prescriptions they need most. If you have a question about the FEP Medicare Prescription Drug Program, you can call 1-888-338-7737 or visit fepblue.org/MedicareRx.